Dave Holtzman is brilliant, both as an investigator and even more as a human being. Dave's work on how the ApoE genetic modifier affects Alzheimer's disease susceptibility has been a breakthrough.
The Hope Center came about back in 2003 when the main goal was to try to better understand common mechanisms that underlie different neurodegenerative diseases so that people could start working on developing better diagnostics and treatments for these diseases.
As chair of neurology and director of the Hope Center for Neurological Diseases, he has assembled one of the world's largest and most influential Alzheimer's disease research groups. This is why I believe the massive problem of this devastating disease will be solved here at WashU in the coming years, and it will reflect the brilliance and leadership of Dave Holtzman.
So in terms of co-founding C2N Diagnostics with my colleague Randy Bateman at WashU, we were trying to better understand the metabolism of one of the proteins that builds up in the brain in Alzheimer's disease called amyloid. We were detecting that we could measure the metabolism of this important protein in real time in people. So that ultimately led to us forming this company, which we thought we could try to develop biomarkers for the disease at the same time. I do like being the director of the Knight ADRC because it's really bringing together a lot of resources that help the entire community that works on Alzheimer's disease. And now there are outstanding blood tests that also can allow one to diagnose the disease when people become symptomatic. It's very exciting because it's really changing the ability to get people on new FDA-approved therapies by not having to do as many invasive tests anymore. There was a Jeopardy screenshot where the answer to the question was about C2N Diagnostics creating the first blood test for Alzheimer's disease. And I think as soon as I saw it, I'm like, wow, that's pretty amazing. Something that I never would have thought might be possible was actually being used in people now effectively. So that was very exciting. What makes WashU unique in regard to neuroscience is really what I think makes WashU unique overall, which is an incredible history not only of science, but of collaboration. It's really in the bones of the place. From the moment I ever got here 30 years ago, I could just see there was something about the culture that imbued not only this great science, but a science where everybody is doing this together.